This is The Road Out, Understanding Addiction and Recovery for You and Your Loved One, with Dr. Margaret Bauman, Medical Director, Psychiatry and Addiction Medicine, Cottage Health, San Luis Obispo Outpatient Program, and Dr. Paul Erickson, Medical Director, Psychiatry and Addiction Medicine of Cottage Health. Today we want to talk about what happens in a treatment center. So doctors, what kinds of treatment happens in a treatment center?
Well, it depends on where you're starting out. We'd mentioned in a previous talk that sometimes you are going to actually go into the hospital for treatment, immediate treatment of withdrawal symptoms from alcohol. And if that happens, then you will be assessed, you will be admitted to the hospital, and then you'll be given medication to help through those early days after stopping drinking to prevent delirium tremens, seizures, those kinds of things.
You may then go on to a residential treatment program, and there you'd have an individual evaluation. If you had a need for help with anxiety or depression, that would be part of your treatment plan.
Right.
If your family had concerns, they would be involved in treatment. That's very important often. You would be introduced to Alcoholics Anonymous meetings, and good programs teach people how to use AA meetings. So how important it is to find meetings that work well for you. There are meetings just for women, meetings for young adults, how to find a good sponsor, and how to be active in AA, meaning working the steps, and really doing the work of AA.
And a good program will often get you started with some of those initial steps while you're in the residential treatment program or an intensive outpatient program, either one.
Do you meet with an individual counselor?
You will be assessed individually, certainly, and you should be. And a good program, depending on the need, may meet with you, or the counselor may meet with you individually.
And you'll identify treatment issues that are very important for you. Some people, for instance, have a history of trauma that affects their drinking. Other people may come with a strong family history of alcohol or drug problems, and understanding that context can be helpful. But there are group meetings as well.
Right.
Group meetings typically are the backbone of most treatment programs.
So you will learn to discuss in group therapy then?
Yeah, definitely. That's a part of it.
Will you see a doctor about physical health or mental health problems at the same time?
You will see everyone that certainly is admitted to the hospital or to the residential program is going to meet with a doctor.
And often there's a physician in the program who will see you. Sometimes you will be referred to a physician in the community as part of your treatment. The physician may not be in the program.
Right.
There is medication-assisted treatment for addiction problems these days, so that there are medicines that you can take that will reduce your desire to drink alcohol. And there's antabuse, which is an older medicine that will make you ill if you drink while you're taking it.
Very ill, yes, very ill. So, and antabuse, you're right, it's been around for a while, but there are some newer ones that actually reduce your craving for alcohol.
How long will you be in the treatment program?
And that does vary. There's an older model of a 28-day program, which people still think of. But these days, programs are tailored to the individual's needs. So somebody may be in a residential level of care 2, 3, 4 weeks. They may then step down to a day program or intensive outpatient program. Intensive outpatient programs typically go for a number of months.
Oh, yes, they do. And you may start off going, say, 3 or 4 times a week for several weeks, and then as you advance through the program and begin to feel more comfortable with sobriety, then you may taper down to less than that.
In the groups, you'll learn about relapse prevention. You'll learn about what are the kinds of cues and conditions that are more likely to lead to drinking, how to be aware of those, how to cope with the triggers to drink again.
Right. Distress tolerance, we call it. How to tolerate the stressful things that happen in everybody's life, and to do it without resorting to using alcohol or drugs.
Okay, we've been talking The Road Out, Understanding Addiction and Recovery for You and Your Loved One, with Dr. Margaret Bauman, Medical Director, Psychiatry and Addiction Medicine, Cottage Health, San Luis Obispo Outpatient Program, and Dr. Paul Erickson, Medical Director, Psychiatry and Addiction Medicine, Cottage Health. To listen to this again or share with a friend, visit cottagehealth.org/The Road Out. That's cottagehealth.org/The Road Out.